So again, I want to start by thanking you for your time and your valuable input. It is invaluable to us that we get outside feedback on what we're doing and where we might be able to improve upon. So again, thank you. This week, we're going to be looking at the assessment plan. And the entire assessment plan is quite extensive there. Feel free to look at as much or as little as you need to provide feedback or as much as you're interested in. If you're one of those sad people like myself that really enjoy assessments, I'd love to talk more about that. But for most of us, I think we're just going to stay fairly high level with that. So we have four goals within our program. Most of them being with other objectives with that. So the first goal is basically prepare students to utilize the knowledge and skills, very skills-based within athletic training. We have different objectives and then the assessments with that. Objective one is progressive knowledge on standardized exams, and we have annual exams that our students perform each year, and they have to pass those exams to move on. These exams include both multiple choice style questions as well as practicals and simulations. And we also have a BOC pre-test that our students take in the beginning of their final year to basically see where they are going into that final year. Objective two there is demonstrate clinical skills on standardized patients, and we have simulations for that. We also have demonstrate skills required, and for those skills we have clinical skill exams where students are asked to demonstrate the very specific skills with yes and no checkbox that they've been tested on throughout the course of their time here. And then last one here as far as goal 4 for the students is demonstrate proficiency on the skills required of the athletic trainers with that as well. And that gets into skill exams as well. So 3 and 4 are just different types of skills. And then most of the time we end with an objective saying for a programmatic objective that we're going to provide quality instruction. And with that, we have different surveys that students complete, both normal course instructor surveys when they're graduating and seniors, and then alumni surveys as well. Goal 2 is more on the hands-on clinical experiences that we provide, specifically in the area of evaluation and administration. So basically the ability to provide care through clinical experiences. And we have evaluations of the students by the preceptors, whether they're in their first rotations or in their immersions. And then they also complete an annual self-assessment for that. And this is one area that if you have any feedback either from completing our preceptor evaluations or if you've had experience with preceptor evaluations of students, one area that specifically we would like any feedback on there or any ideas that you might have with that. And then objective 2 is the preceptors will provide the quality experience and the students evaluate that as well. For goal 3, then we're now more in the soft skills of athletic training, confidence, interpersonal skills, and then again demonstrating those. Now we have those same evaluations that we completed for goal 2, but when we collect that data, half of that data is asking about more of the hard skills, the actual ability to do the job of an athletic trainer, whereas goal 3 is now that interpersonal as well as professionalism skills with that. And then our final goal is to prepare graduates to become qualified healthcare professionals. First objective is that they pass their BOC, so we have the BOC pass rate, 6-month employment with that, and we collect that through an alumni evaluation. And then goal 4.3 and 4.4 really are about fitting in and understanding the role of athletic training and then themselves in that role. So in 4.3, this idea of including the role of athletic trainer as a valuable member of healthcare, we have these critical appraisal guide sheets in their final year. They lead basically a journal club with their fellow level 3 students where they talk about the current level of evidence and kind of the professional development, right? Where they talk about how they can use this and become the role of an athletic trainer within the healthcare team. 4.4, their own personal strengths and weaknesses. We ask them to do case studies at the end of each semester where they evaluate their care in the clinic regarding a specific case. And then finally, for 4.5, practice working collaboratively with that. This is very much in our immersion journals and then our employer supervision evaluation form where we survey employers of our recent graduates and they give us feedback as well. So again, that's kind of a very high overview with that. More information is available in the actual assessment document. And if you have any questions, I'd love to talk more with you and look forward to your feedback. Thanks again.